You may have seen in recent years, studies about diet soda or diet drinks or artificial sweetener drinks or foods increasing your appetite or making you more hungry or likely to eat more. So recently, I was looking at a study that looked at like what potentially could make that happen, the changes in your brain when you have zero-calorie sweeteners. And so basically, the study was looking at sucralose as zero-calorie sweetener and people drinking sucralose sweetened beverages versus sugar sweetened beverages or sucrose versus drinking water and the changes in their brain that happen. And this is in non diabetic patients. And so people who have normal regulation of their blood sugar insulin system. And basically, what they saw is that normally, what happens when you have a sucrose or sugar sweetened drink, and I'm not telling you to have that, but if you have that, it decreases the blood flow to the hypothalamus. That's the part of the brain that regulates hunger, and then you feel less hungry. And so, what they saw with the artificial sweetener or the zero-calorie sweetener sucralose drink is that it increased the blood flow to that part of the brain, the hypothalamus, and people felt hungrier when they had that versus water, which you would still feel hungry after drinking water as you didn't eat or drink anything substantial, but it did not increase the blood flow to that part of the brain, the hypothalamus. And so that's important to know. Not that you should, necessarily stop having zero-calorie sweeteners, but just that you should be aware that you could end up. It's not an issue of like willpower or self-control. It can create a change in your brain that makes you more hungrier and more likely to eat more. So if you're eating a salad, or something healthy, it may not matter. But if you have unhealthy food like processed sugars or carbs in front of you, then you may end up eating way more than you normally would. And so that's something to consider, potentially if you are, having an unhealthy meal, that you have less artificial sweetener or zero-calorie sweetener drinks with that, or not at all potentially if possible, and then you'd be more likely to eat what you would normally eat and not end up eating more related to like what you're drinking if it is a artificial sweetener or zero-calorie sweetener type drink.